Patty Starker here from WestfordCAT, and I'm with Jeff Stevens, Westford's Health Director. Happy New Year, Jeff.
Happy New Year, Patty. How you doing?
I'm doing good. I'm doing great, actually. I feel refreshed. It was nice to have some time off, and I hope you got some time off as well.
Not as much as I'd like, but that's okay. We're just cranking right along.
Yeah, I know. I can imagine. I know there's an uptick in cases since the holidays and New Year's Eve. We talk a little bit about that?
Sure. So one thing that we've all heard on the national news and we've seen on a lot of posts that I've put on our Facebook page is really since Thanksgiving, we've seen our case numbers jump up. And that's been clearly a direct tie to people getting together, having family parties, going to places where there's a lot of people, and the numbers clearly reflect that. We saw an uptick at Thanksgiving, it jumped up. We saw an uptick at Christmas that we just got through, and now we're seeing the start of an uptick based off of our numbers today in Westford due to New Year's Eve. And New Year's Eve was a week ago, and now we're actually seeing those numbers pop into our Maven caseload because people were out, they didn't feel well, or were told they were around somebody. It takes 2 to 3 days to get tested, takes 2 to 3 days to actually build up the virus in your system, put you around day 7 or 8. We're at day 8, and sure enough, we have 17 cases today, whereas yesterday we had 7.
Wow, it jumped up that much, huh? So what about the percent positivity rate?
So the percent positivity jumped up last week from 6.1 to 7.34. And it was slowly declining. And when I say slowly, very slowly declining over the past weeks before that. And now we're seeing that percent positivity go back up. And what that means is it's the amount of people that are sick compared to the amount of people that are tested. So the more people that are tested, the lower that number may be. So if you, in this recent group of tests, we had just under 2,000 people tested, but we had 10 more people positive than we did the prior week. So
I'm glad you explained that because people misunderstand and they think that's the percent of people that are positive.
Yeah, it's not the percent of people that have been positive in town. It's the percent of people that were positive in that batch of testing in 14 days.
Yeah, interesting. We've talked about that before, but I just wanted to have you clarify that again for someone who might not have seen a past episode. But so there is a light at the end of the tunnel. The vaccines are rolling out. How does it look for Westford?
So currently Westford is in collaboration with Tingsboro, Tewksbury, Billerica, Dracut, and Chelmsford. And we are running the first responder clinics for all of our police, fire, and vaccinators on next week. They're being sent links to register for that clinic that's being done in 15-minute increments. And what we're planning on doing is this is going to be our run to see how this vaccine and the software we're using to track it rolls out. Once we do that and we get this group of people done, which is going to be around 800 people our first week, we'll wait for the state to release more vaccine, and we'll look to see what the next group of people will be that we can vaccinate. We're going to have to organize those clinics in town. They'll need to be longer term. It's not like a flu clinic where you do it just 2 or 3 days. We could be vaccinating as many as 16,000 people in town. We don't really know until people sign up and get vaccinated, but the potential's there.
So what is the actual date that the vaccinations start?
So the actual vaccinations for our first responders will start on the 12th.
Is that Monday? I don't have a calendar in front of me.
That's a Tuesday.
That's a Tuesday. Okay, so Tuesday, January 12th. And where will the clinic be held?
That is going to be at the Chelmsford Senior Center because that's a central location to all those communities. We have the vaccine currently in storage and ready to go, and it's secured, which is really important. And the only people that will be vaccinated at this clinic are people that get the link to register and are verified as first responders for their respective communities. So we already have a master list and we know who's going to be coming in.
Is this a 2-dose vaccine?
We're using the Moderna vaccine. It wasn't really a choice for us, but that's what was given to us. And it is a 2-dose vaccine. It is going to be given, the first dose will be next week, and then the second dose will be 4 weeks later.
Okay, wonderful. And I think you said you're not sure when the next batch of vaccines will be coming in for the next group of people that are able to be vaccinated, which are essential workers. And there's a list of those, correct? It's like a first group of essential workers and then a second
So
tier.
how that phased approach is going is right now we're in first responders, and healthcare workers are going to fall directly under them that aren't already COVID facing healthcare workers. And then phase 2, which is projected to start in February, will be people over 75 years old and people with 2 or more comorbidities, which would be if you are have a heart condition and diabetes,
Right.
Or COPD or something like that.
Mm-hmm.
Those people will be allowed to be vaccinated next. And then after that, there's a very large list of people that includes essential workers, such as grocery workers, K through 12, utility workers, and the like. The next after that, I believe, is people over 65. And once that phase is done, it will go to general population, which is people that don't fall into any of those categories.
So is this free, or do you go through your health care?
The vaccination is absolutely free. However, we are going to ask people to have their health insurance card. We are going to be able to bill for administrative costs, which should help offset some of the cost of running the clinics.
Right. I mean, you guys are busy. This is going to take some manpower. We'll just keep people posted through this program, and they can also go on the Westford Health Department website, correct?
Yes, on the COVID-19 website on the Westford Health Department page, there is a direct link to the states that says, when can I get my vaccine? That link is updated every Tuesday and Thursday for any changes that might make in a certain population. I want to point out the local health departments in the state are not choosing who they're going to vaccinate. The vaccinations are being chosen by the state, by certain populations, based off of risk. So when we run a vaccination clinic, we're not picking the group of people. We're being told this is your population.
Gotcha.
So that's important for people to know that it's not a pick and choose. It's here's your population. So when we say 75 plus, we're going to schedule a 75 plus clinic. We're going to be checking IDs and making sure that that's the population we have.
With this vaccine, I've heard that some places that are, distributing it are having people hang around for about 15 minutes to see if there's any sort of reaction. Do you plan on doing that?
Yes, that's actually a requirement. Anybody who gets the vaccine is going to be told they need to wait approximately 15 minutes to a half an hour, depending on how you're feeling, and then you can go back to doing your normal things. We're hearing a lot of the side effects are generally a sore arm at this point. There are some others where people have not felt well for a day after, but really we haven't seen enough locally to know exactly what some of those side effects really are. So when we start vaccinating, we'll be able to take some notes on what people are seeing and feeling and build off of that.
Sounds great. Exciting. It seemed like this was going to be forever, and now it's finally here. So I'm excited about it.
Yep. And it's just important to remember that while we're here and while we are right at that precipice of getting that vaccine out, for the vast majority of the population, you're not vaccinated yet, which means you can't let your guard down, which means you still need to wear your mask. You still need to make sure that you're doing all the right things, socially distancing, and making sure that you're keeping your family safe by doing the same things, washing your hands. Very, very important. We know those are interventions that work. So keep doing those things. We're close to the end. We know we can feel it, but we got to just keep towing the line.
Yep, just keep pushing along. All right, Jeff, good news. And we'll touch base again next week to see how the clinic is going.
Yeah, I'll be more than happy to talk next week. Not sure what I'll have for time yet, but maybe Thursday after this clinic, we can talk about how it actually ran.
That sounds good. I'll put it down on my calendar, Jeff. We'll talk to you next week. Good luck. Stay safe.
Thanks, Patty.
For WestfordCAT, I'm Patty Stalker.